Hey everyone, Dr. Foley again. Want to talk to you about fibromyalgia. They say there's an unknown cause, but I'm going to tell you what I found clinically over the past 30 years with fibromyalgia. Of course, it's a chronic pain lasting at least 3 months. There can be headaches involved in it, fatigue, tiredness, feeling worn out, of course, aches and pains all over the body. Here's what I found, and we have good results in my office when we actually address these issues to get rid of fibromyalgia. I find that there's lots of toxins. You know, we are filled up with toxins, especially heavy metals. We collect these heavy metals throughout our life, and they will accumulate and they attach to the cells of the muscle, and they can cause a lot of what appears to be fibromyalgia. Also chemicals. There's 2,000 new chemicals made every year in the United States. And unfortunately, they don't do a lot of testing on them to how they affect people or how they affect our environment. They've done studies on newborn babies. They're stillborn, and they're finding 232 different toxins in a newborn or stillborn baby. That's a lot of chemicals in our environment. They get into the tissue and they mimic or they cause fibromyalgia. Insulin resistant. This is becoming a big problem due to our food supply. If you're eating a standard American diet, you just change your diet, cut out all your carbs, that could help with your fibromyalgia. Low testosterone. Of course, this is a hormone, not just in men, but also in women. If you have a test and you have low testosterone, you have fibromyalgia, that could be an underlying factor. Low vitamin D is related to fibromyalgia. Gallbladder problems, especially if you're experiencing most of the symptoms on the right side of your body. With the gallbladder, a couple things happen. The gallbladder is a sac. It can get filled up with toxins. It can get filled up with chemicals. It also holds bile salts. The bile salts are made in the liver. They're held in the gallbladder. And then when food goes through, the gallbladder contracts, puts the bile salts in the food to break down the fats. But that bile salt itself can get thick or of poor quality. And those are the things that we handle at my office. Low electrolytes, like magnesium. Magnesium, calcium, and potassium are the 3 major ones that can cause some big problems with muscles. So we want to rule out some things that mimic fibromyalgia. One is hypothyroidism or Hashimoto's. That's an autoimmune disease that attacks the thyroid. It can mimic and look like and feel like fibromyalgia. To get rid of fibromyalgia, you must reduce the carbs and sugar in your diet. You need to get your carbs down to at least 75 net carbs per day. If you're eating 3 meals, that's only 25 carbs per meal. That is normal carbs. The average American's eating 400 to 500 carbs per day. Salt. I know you've been told, don't eat salt. Well, you can eat salt. You do need salt. There's a lot of electrolytes in salt, but it has to be sea salt. Sea salt has 70 different minerals in it. And it's safe for people even with high blood pressure to use sea salt. It's rare if it ever pushes up the blood pressure. Avoid low-fat diets. You want to mess up your metabolism? Get on a low-fat diet. Our body has to have fat. Medications that they give for fibromyalgia are of little help and they are dangerous. They have side effects. So that's what we look at, and that's how we handle fibromyalgia in my office. I'll see you on the next video.